My name is Ashley Westbrook, and I am here to do my speech on Communications 101, and here are my note cards. Okay, and my audience members. Okay, so I wanted to talk to you about how I am a volunteer at my local community hospital at Summerlin, and I questioned myself if this was the right move for me, because I do want to be in the medical field and I want to become a registered nurse, but I didn't know where to start. So when I found out that they had a volunteer program, and I found out they had a cuddlers program, which involves holding babies that are born premature, drug addicted, and with family members that can't always be around, it inspired me to actually explore that field. So I didn't know what to expect going in, and I questioned myself, is this the right direction for me? So a little bit of information about the cuddler program is it supports the developmental growth of each infant that is born premature, drug addicted, and when family members can't be around for their babies all the time, this is where we step in and we are able to hold and cuddle these babies that need that support for that growth and for that comfort. A lot of these babies are on, they're on feeding tubes, they're being monitored 24/7. I've seen some babies in there that were there for 5-6 months. And even though it's the saddest thing to see, it's also a relief when you see that baby cry and you hold them and they just stop crying. And you see this little smirks on their face, and you see the family members come in, and you see that they're happy that somebody was there to hold them and comfort those babies with knowing that there's somebody there for them, their babies, when they can't be there. This has given me a lot of experience and skills going into this, because I get to work with the staff members of the hospital that I actually want to work at in Summerlin, and I want to be a nurse in pediatrics or in the NICU, and this is even giving me that extra step to go about doing this. It gives me the experience not only in my community, but it also gives me the experience in a positive way to work with these nurses and to work with these patients and to work with these family members that just need that extra help that they can't get. So I get the first-hand experience interacting with the infants, the families, the staff, and I get to show that the families that their babies are in good hands. So to answer my question, yes, I am going in the right direction. This is exactly what I want to do with my future as a nurse. This is what I've been looking forward to for the past year and a half that I've been wanting to be a nurse, and becoming a volunteer in October this last year in 2018. It has made me, it warms my heart that I'm able to do this for every baby that I get to hold, for every family member that I get to help. So at the end of the day, it's really about the patients and the care that the families get to see that we do for their children, whether they be new parents or parents of other children, but they have a difficulty situation with their newborns. Thank you. And my net audience.
I'll show myself.
Yeah.